Hello friends, welcome to another episode of Learn with Me Nurses. So this will be a study material for DHA, HAD, MOH, Prometric exam and for nursing university exams. In this episode, we'll have a look on the gastrointestinal disorder, mainly cholecystitis. Before moving on to the disorders, we will have a quick review on the basics of gastrointestinal system. First, we will have a look on the quadrants of abdomen. Mainly, we have four quadrants of abdomen: right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. These are the four quadrants of abdomen. So now we will see each one by one. Right upper quadrant. The right upper quadrant mainly consists of the organs liver, right kidney, colon, gallbladder and the small intestine. So these are the organs in the right upper quadrant. Next, moving on to the left upper quadrant. It consists of the spleen, left kidney, stomach, colon, pancreas and the small intestine. It is very important to remember what are there inside the quadrants. And next we will move on to the right lower quadrant. It consists of the colon, small intestine, right ureter, appendix and right ovary and the fallopian tube only in females. These are the organs in the right lower quadrant. Next is the left lower quadrant. It consists of the colon, small intestine, left ureter and the left ovary and the fallopian tube only in females. So this is all about the quadrants of abdomen and the organ it consists of. Moving on to the first disorder, cholecystitis. Cholecystitis. It is the inflammation of the gallbladder. Now we will see what is gallbladder. Gallbladder is an organ that is situated in the right upper quadrant and it is situated just below the liver. And we will discuss about the main function of the gallbladder, that is to store the bile that is produced in the liver. This is the main function of the gallbladder, storage. Gallbladder is the storage of the bile. So here I am using a diagram to show you what will happen in cholecystitis. This is the gallbladder and the gallbladder will have the stones inside it or it can be found in the duct also. This is the gallbladder and as you can see a stone is there in the cystic duct and this is the common bile duct. This is the stomach. So the inflammation of the gallbladder is represented using this markings outside the gallbladder and this is the stone that is formed in the cystic duct. Now we will see the risk factor. The risk factor is cholelithiasis. Cholelithiasis means it is the formation of stones in the gallbladder. Now we will see the symptoms of cholecystitis. So as you know, the gallbladder is situated in the right upper quadrant. And the first symptom of cholecystitis is pain. The pain that is originating in the right upper quadrant and radiating into the scapula. So the pain will originate in the right upper quadrant and radiates to the scapula. The second symptom of cholecystitis is Murphy's sign. What is Murphy's sign? If the patient is kept in supine position and if we apply a pressure on the right upper quadrant of the abdomen, the patient will have dyspnea. So, if we are applying a pressure on the upper quadrant of the abdomen, the patient will have dyspnea. That is Murphy's sign. So, there will be a pain in the right upper quadrant that will radiate into the scapula, and then the patient will have dyspnea. And the other symptoms are like nausea, vomiting and fever. This is a picture showing Murphy's sign. Now we'll see the complications of cholecystitis. The first complication is biliary ductal obstruction. In biliary ductal obstruction, there will be a complete obstruction in the duct. So there will be no passage of bile from and to. In this complication, we can see a condition called steatorium. Steatorium means it is the presence of bile in the stool. Steatorium can be seen in the biliary ductal obstruction. And the second complication is jaundice. In jaundice, there will be a icteric skin and sclera. And the third complication is hepatomegaly. And next one is splenomegaly, and there will be also a severe nausea and vomiting. Another complication is gangrene. Gangrene means it is the tissue death that is caused due to the decrease in blood flow to the tissue. Moving on to the management of cholecystitis. The first one is the patient will be kept in NPO from admission, and the patient will be administered IV fluids, and antibiotics will be administered to the patient such as metronidazole and levofloxacin, and administration of analgesics. The next management is endoscopic, retrograde, cholangio, pancreatography. So this is a procedure that is done to remove any stones that is blocking the bile duct or cystic duct. This is about ERCP. And if the inflammation reoccurs after this, then we will be doing another procedure, cholecystectomy. This cholecystectomy means it is the removal of gallbladder. So moving on to the postoperative management, the first and important management is the dietary management. So patient will only be given a low fat diet. And the next management is avoid large servings. This large servings to be avoided. And the third one is patient is given only small and frequent meals. This is all about cholecystitis. Here we have a sample question. A 52-year-old man came to the hospital with complaints of radiating pain on the right side of the abdomen. On examination, the patient is having dyspnea when pressure is applied to the right upper quadrant. What condition is the patient diagnosed as? So this is a sample question. This is a pattern of questions you will get for exams like DHA, Heart, Prometric, etc. In my upcoming videos, I will be sharing more questions with you. Thank you. If you like my videos, please like, share and subscribe. Feel free to comment for my videos.